Hello everyone, I am Sakshee Chacharkar, a volunteer with Shivi Forensic. In this video, I'll be explaining you the ADME process. So, let us begin with what ADME is. ADME is one of the broader concepts in the field of pharmacology and pharmacokinetics. Here, A stands for absorption, D for distribution, M for metabolism, and E for excretion. This concept describes the journey of a particular drug, let it be a medicine or any pharmaceutical compound within a body, from the moment it is absorbed until it is eliminated. And all of these above mentioned four criteria influence and also determines that how well the drug works and for how long on a tissue or a body. Now, pharmacokinetics is about where the drug goes and for how long, and pharmacodynamics is about what the drug does once it gets there. So, together they determine that how well a medicine or a drug, or let it be a pharmaceutical compound, works on a body. To simplify this, think of your medicine as a delivery package. Okay. Now, pharmacokinetics is the shipping process of how the package gets into your system, where it travels, how long it stays before your body removes it, and pharmacodynamics is what the package actually does to your body when it arrives, like relieving pain or lowering blood pressure or anything, etc. So this slide presents the diagrammatic representation of ADME process and a brief description about it, which I'll explain you in depth in further slides. Let's begin with absorption. So, it is a process by which a drug moves from its site of administration into the bloodstream. Now, there are various modes of administration from where mostly after consumption drugs are absorbed through passive transport across membrane. But here also there's an exception, that is the intravenous administration. It completely bypasses absorption as the drug is directly delivered into the bloodstream via injections. These are some of the factors which affect the drug absorption, such as solubility, concentration gradient, surface area, blood flow with respect to the form of matter, amount of dose, surface area, and blood supply. This flowchart covers all the routes of drug administration. In enteral path, the administration of drug is through the gastrointestinal tract. In parenteral, administration of drug is via injections or infusion. And in topical, the drug is directly applied to a body surface. These are the certain mechanisms for absorption. In passive transport, there is simply a movement of molecules through channels or membranes with respect to concentration gradient and no utilization of energy via diffusion or osmosis. But in active transport, it's completely opposite. It utilizes energy in the form of ATP and against the concentration gradient. And in another, it moves large amount of materials or big molecules across their membrane, which are wrapped in a membrane or a bubble. Now, bioavailability is the proportion of administered drug dose that reaches the bloodstream and is available to produce an effect. But it is always less than 100% for oral drugs. The reason is incomplete absorption, as complete drug is not absorbed via gut or the intestinal or liver enzyme which may break down the drug, or the biliary excretion. Next is distribution. Here, drug moves from the bloodstream into various tissues and organs throughout the body, which is not uniform. And this action is carried out via blood, which lowers the drug concentration in the blood as it spreads into tissues and organs all across the body. Now, volume of distribution is a pharmacokinetic parameter that is calculated after a drug has been administered, absorbed, and distributed. Now, this is expressed in liters, and the formula to calculate this is dose administered upon plasma concentration. This slide presents the pathway in transporters and pharmacokinetics in diagrammatic form. Next is metabolism. This is the biochemical process by which body breakdown and chemically alters the drug. Now, this action is primarily occurred in liver, but although other tissue may also contribute. This is carried out by redox enzyme like cytochrome P450 as mentioned, and it can convert the original parent drug into new compound which are called metabolites. Now, after metabolism, we can get various outcomes. Most metabolites are inactive, which deactivates the drug and reduce its effect. But some metabolites remain active, which occasionally are even more potent than the parent drug. And metabolism can sometimes produce toxic metabolites too. Now, this can contribute to adverse effects. Now, this slide presents the various factors which may affect the drug metabolism, such as the age, disease, species, genetics, sex, drug dose, or the diet, or anything. Now, metabolism occurs in two phases. In phase 1, it converts the drug into hydrophilic compounds, and many reactions occur here, such as oxidation, reduction, and hydrolysis, which makes drug electrophilic, nucleophilic, or may break bonds. In phase 2, it increases the water solubility of the drug by adding larger polar groups and making drug less lipid soluble so it can excrete easily. Now, various conjugated pathways are acetylation, methylation, sulfate conjugation, and many more. Next is excretion, the process by which drugs and their metabolites are removed from the body to prevent harmful buildup. The main routes of excretion are renal excretion through kidneys in the form of urine, the fecal excretion through liver and gut in the form of feces, and pulmonary excretion through lungs in the form of gaseous volatile substance. Other minor routes are sweat, saliva, tear, etc. This brings us to the end of our session. Thank you so much for your attention.